So good afternoon, everyone, and welcome. My name is Debora McDell-Hernandez, and I'm the Senior Director of Public and Community Affairs at Planned Parenthood of Central and Western New York. And Planned Parenthood is happy to present today's program, which is titled A Look at COVID-19 Through the Lens of Social Justice. I assume that most of you are familiar with Planned Parenthood and what the organization does as a whole. But for those of you who are not, Planned Parenthood of Central and Western New York services over 31,000 patients a year, adults and teens. We have a presence in 3 hub cities, Syracuse, Rochester, Buffalo, as well as Niagara Falls, and several smaller communities in between. So we serve rural, suburban, and urban communities. We provide high quality, affordable, non-judgmental reproductive health care to all and promote responsible, healthy sexuality and advocate for access to comprehensive health care. And we support those affected by sexual violence through our program, Restore. So that gives you a little bit of a background on us. And as an organization, Planned Parenthood has over 100 years of experience in doing advocacy work. We're in a unique position to be in a role to advocate for people to have agency over their bodies, men and women, people of all genders, orientations, and ages. We're also in a unique position to be able to advocate for people across socioeconomic, the socioeconomic spectrum, in that we are advocating for reproductive health rights, but many of the causes that we advocate for go beyond reproductive health and also go into gender equality, equal pay, items like that. So there's a lot of cross movement. We understand the importance of collaboration and unity, and there was more power and strength in numbers, and many different groups, especially marginalized communities, are under attack these days, be it in relation to reproductive health care or something else. So we're looking at COVID-19 through the lens of social justice for all of those reasons and for all of those territories that we cross. This is probably the perfect storm in the sense of looking at something like social justice and intersectionality. No one saw this coming to date. There have been 82,246 deaths in the US. This is according to the CDC, looked at the website just a few minutes ago, and 1,364,061 cases in the US. So we do not take this crisis lightly. As an organization, Planned Parenthood is continuing to serve our patients to the best of our ability. Many of them are now accessing our services through telemedicine, since we are complying with the guidelines set by the CDC and New York State and the county, and limiting the amount of patients actually in our facilities. But we're still here to serve our patients. They can visit our website and figure out the best way to access services, education, and help. So I've invited some guests from the community to join us today in this discussion, and I'll quickly introduce you to them. We have Rachel DeGuzman, who is the founder and executive director of Woke Art Collaborative in Rochester. We also have Dr. Nayda Pares-Kane, and Dr. Nayda Pares-Kane is a professor and chair of anthropology, history, political science, and sociology at Monroe Community College in Rochester. And my colleague Solomé Rose is the Director of Diversity, Equity, and Inclusion at Planned Parenthood of Central and Western New York. So the way we're going to work today's program is each of our presenters will have an opportunity to do a brief presentation, and I will ask that you hold your questions until the end of the presentation, and then we will check the chat section and address your questions or concerns. So if you do have questions, just try to jot them down in the chat section during the talk. So the way this will flow is we'll start with Dr. Nayda Pares-Kane, and she's going to give us a bit of an overview on a system that was already fractured, inequitable, even before we were hit with the COVID-19 crisis. And she will pay special attention to issues like social determinants of health, intersectionality, and structural racism, just to name a few. And she will be followed by Solomé Rose. And Solomé will reinforce some of those points that were made earlier and also include some national and local data to demonstrate how COVID-19 has impacted communities of color disproportionately. And then we will end with Rachel DeGuzman of Woke Art Collaborative. And Rachel is going to speak about a specific community of color that was impacted by the COVID-19 crisis. Artists of color are creatives who rely heavily on the gig economy and were financially devastated by this. However, there is a bright spot because Rachel participated or led a very successful fundraiser to address that concern and need. So she will talk about how she is helping that community of creatives. So thank you again for joining us. I am going to stop sharing this screen so my colleagues can share their screen. So we are going to start with Dr. Pares-Kane and Nayda. Thank you very much.
Hi, everyone. So my name is Nayda Pares-Kane. I am a sociologist, but I'm also a sociologist, woman of color. So I like to begin my presentations with stating that ahead of time, simply because it is a particular status and role that I occupy and gives me a particular perspective. So I'll just start with, let's see, I will move. All right. I'll start with, like Debora said, what we already knew before the pandemic. And I'll just start by saying that in sociology, what we do is we study human society and social behavior. And part of that is obviously taking a look at our well-being. And our well-being does encompass our bodies and our social behaviors. But I should also state that when we talk about sociology, we're not just talking about taking a look at group behavior, we're also taking a look at how the individual interacts with those social forces that are out there. And so we begin with the premise that our bodies are social objects and that our physical selves have socially constructed meanings, and that is shaped by all of the social forces that are out there. So in particular for today, I'll just talk about some of the social determinants of health. And obviously we know that there are many different disciplines, we were talking about this before, many different disciplines that take a look at health in general. And in the social sciences, what we do is we take a look at what is out there in society that helps us understand what it means to be a healthy person. We know that studying physical science helps us understand health, but health is also very social. And so our individual health is subject to a lot of differences and influences depending on where and when we live and our place in society. It's interesting because the WHO, the World Health Organization, defines health as a state of complete physical, mental, and social well-being, but it also says it's not just the absence of disease and health. So it does matter where we're socially located. So here, I'll just go over some of the social determinants of health. We know that economic stability is really important. Things like employment and income and expenses, how much debt you have, Do you have any medical bills? What kind of support systems do you have economically and financially? Our physical environment, that's our neighborhood, where we live, what kinds of housing we occupy. We know that we have really high rates of residential segregation all over the country. That tends to be centered in our urban areas for the most part. But we also have homelessness, and you can't shelter in place if you don't have shelter. Other determinants, transportation. What kind of jobs are near where you live? Do you have parks? Do you have playgrounds? Can you walk to certain places? What's your zip code? So geography does matter. Education, we know that literacy and language is important in understanding your health, your physical well-being, but also higher education. What are you learning in school necessarily that will translate into understanding not just your body, but all of the other factors that we're talking about? Education isn't just going to school, it's also the knowledge that you acquire from one generation to the next. And that can be cross-cultural, and it does have an economic determinant as well. Food, who is hungry, right? Who experiences hunger? Who has access to healthy options? We know that food deserts are a problem, right? Where can we get healthy food? And we tend to see food deserts intersect with class and race and gender as well. The community and social context. So how well are you socially integrated? What kind of support systems do you have? Are you engaged in your community? Do you experience discrimination? Are you under stress? All of these factors are important in understanding the community in which you live in. And finally, the healthcare system. We know that the healthcare system in the United States is very reactive for the majority of people in our country, meaning that we're not necessarily proactive about keeping ourselves healthy. And a lot of that has to do with all the intersections that we're talking about: class, race, gender. We know there's a substantial number of people in this country that still don't have access to healthcare or quality healthcare and have no insurance. You know, we have a healthcare system that is for profit, and that can be quite problematic. I also wanted to just define really quickly what we mean by intersectionality. The interconnected nature of all of the social categories that I'll be referring to, such as race, class, and gender. Like I said, we don't occupy just one of these sectors. The person we are is constantly intersecting and constantly overlapping with other parts of society. And so we're also shaped by those social hierarchies, and unfortunately, way before any pandemic hits a society, we measure what kind of inequality we do have. So I'll just talk really briefly about these intersections of class. We refer to class in terms of socioeconomic status. So people with higher SES, they can afford more, better healthcare, they have greater access to other resources, and that positively impacts their health. People with lower SES, they have substantially higher rates of disease with higher death rates and shorter life expectancy. And highly educated adults have lower mortality rates than those who are less educated. And this holds across all racial, ethnic, gender, and age groups. In terms of race, I want to begin with the very clear statement that racial differences in illness are not the result of biological or behavioral differences in race. They are a result of racist systems that structure our lives. And so we're constantly hearing how we know that there are higher rates of death and shorter life expectancies in terms of people of color in our country. Simply stating that doesn't help us understand why. So we have to begin with the idea that that is not a biological difference. And attribute to some health concerns, but we don't find that we can connect those strictly through biology. And many problems that affect people of lower SES, so you can see how that intersects. It's further exacerbated in minority groups. Blacks have high rates of death and disease, shorter life expectancy than whites, and Blacks and Latinos are less likely to be able to afford health insurance. They're more often exposed to unhealthful surroundings at work and in residential neighborhoods that tend to be segregated. In terms of gender, it's interesting because women are generally healthier and enjoy a longer life expectancy than men. But men and women do suffer from the same diseases like cancer and diabetes in about equal numbers. Interestingly enough, the male body has always been treated as the standard in healthcare. And so we're beginning to see how we need to start talking about disease and illness in a much more detailed way that takes into account difference. We know that the gender pay gap and workplace inequities, they result in underinsured people and discriminatory health outcomes in general. We know that gender inequality strips women in particular of their ability to control their sexual and reproductive options. It limits their right to choose when and if they wish to start a family. This is becoming a problem across the gender spectrum because we're unfortunately seeing lots of disparities in many marginalized groups across the gender spectrum. It's not just a binary discussion. I have to say that in doing some research for this presentation, I came across this fantastic article recently written. The article is called Racial Capitalism, a Fundamental Cause of COVID-19 Inequities in the United States. It's by Dr. Pirtle from the Journal of Health, Education, and Behavior. And what I found so interesting about this is that it talks about this concept of racial capitalism as a fundamental cause of disease in the world. So if we take a look at our modern world system, we know that we have the system we have today because of racialized actions taken for whatever reason, right? But we have the institution of slavery, we have examples of colonialism, we have genocide. We know that wealth in our country was built using this, these institutions. And unfortunately, what we've seen in the last 50, 60 years is this increasingly neoliberal politic. And neoliberalism, I put on the screen, it's defined basically as tax cuts for the rich, cuts in social programs. We call that austerity, right? Really harsh cuts in social programs. You couple that with deregulations, privatizing the public sector, reducing the power of unionized labor. All of those intersect. And that particular type of politics has become, unfortunately, what we have been reacting to in the last 50 or 60 years. You bring in geography, as I discussed before, so disinvestment in certain neighborhoods, right? Racially segregated neighborhoods, homelessness, toxic pollutants, where, even though we passed the Affordable Care Act, we continually believe that a privatized health insurance system is the best way to go, even contrary to all of the statistics that are out there that say it's not working. We have to deal with provider bias, and I just want to make sure everyone understands that when we talk about some of these problems, we're talking about systems, we're not talking about individuals. So the majority of health providers do a great job, but we just do deal in general with a bias that many of us, even people of color, have in terms of providing services. And obviously the most important part of the health insurance system is that we have people that don't have access to it. We have a system, something called structural racism, and if you experience this kind of discrimination, you're experiencing real stress and a lack of control over your life. This adds on to the health issues that we know existed even before the pandemic. And then the basic restricted access to very flexible basic resources like food, medicine, shelter, and treatment. And so what do we know about COVID-19? Part of the reason I loved the article that I found was that the author was very clear that pandemics are snapshots of who we are, what we believe, and what we value. And so unfortunately, if all of these problems existed before, the pandemic is going to magnify all of these structural fractures, right? And so pandemics, they exacerbate inequality, all types of inequalities, the ones we discussed, and it may create new ones because other people who perhaps were okay before the pandemic are now experiencing some of the same issues we've been dealing with at smaller numbers, but everything from homelessness to being discriminated against. Pandemics exacerbate racist tropes. Unfortunately, our current president of the United States is feeding into this idea. And so if you turn on the news, which I've had to really be very careful about how much news I'm taking in every day, because it's quite depressing, but still having to stay informed. If you watch the news, there is no message out there that is trying to shift the conversation away from these racist tropes. Everything from this is a Chinese virus to all of the racial disparities we're talking about today. Somehow people themselves have brought this upon themselves. And in terms of pandemics in general, whenever we talk about a pandemic, we talk about the country of origin in which the pandemic is centered on. And there's nothing wrong with saying that the virus was first detected in China, right? And there's nothing wrong with saying that we need to have greater discussions about things like wet markets and public health in general. But when those discussions simply become centered on a particular group of people, it actually contributes to a lack of a good public health response because it leads to scapegoating, right? And I'm sure we'll have plenty of time to talk more about that, these racist tropes that exist out there. The pandemics also exacerbate environmental injustices. And so because we're in the middle of this crisis, all those communities that were already dealing with environmental problems, for example, Flint, Michigan, our focus is lost, right? Because we're dealing with a particular problem right now, and we don't make the connection that those communities were experiencing that before the pandemic because of all of these structural problems that existed beforehand, right? So what do we need to do? Public health must look beyond the individual and the interpersonal characteristics, and we need to really start to take a look more at institutions, environments, and ideologies that promote access and resources according to need. And I just, I want to shout out to all of the students and current people working in public health, because it truly is an area in which it can be quite thankless, right? My sister Vivian is with us today, and she's a student of public health, and we're constantly talking about how to make those connections, right, between the physical science of health and the social determinants of it, right? And finally, any kind of change that we're talking about, any kind of fundamental social change, it really has to address the systems that produce the inequalities. So even though I've heard many people lately say that we should not politicize the pandemic, right? We need to kind of not have these political divisions and discussions. I say this is exactly the time to do so. It is exactly the time where you need to politicize what is happening, because there is a magnifying glass on it, right? And this is a time to be able to look at what was already happening and how this pandemic is making things actually worse. And sometimes social change does come because there is a spotlight on a particular issue, right? So I'm sure we'll have time to talk about it, but the current federal government hasn't just done a poor job with this pandemic for the last 3 years, and I would argue it crosses party lines. We have, this particular administration, the Trump administration, has rolled back all kinds of gains in terms of the Affordable Care Act. And I certainly think that, we do need to go further than the Affordable Care Act. But there's a real decentralized response from the federal government, and lies and dangerous solutions only exacerbate the problem. So our current pandemic is no different than before. We have to acknowledge and rectify historical injustices, value all groups and populations, provide resources according to need, which is what equity really is. It's not about things always being the same. It's about providing resources to groups that really need them. That is the definition of equity. And finally, we need to change public policy and the current healthcare system. And in order to do that, it does mean that you need to get politically involved. Simply saying that this is not the time to talk about politics is really ignoring the reasons why we find ourselves in this situation. And so that's it for me, and I'll mute myself and take questions at the end.
Okay, thank you, Dr. Pares-Kane. And I will give my colleague Solomé Rose a chance to prepare to share her screen, and make sure you unmute yourself, Solomé. And again, so I know some people have been jumping in a little later in the program. Our next speaker is Solomé Rose, and she's the Director of Diversity, Equity, and Inclusion at Planned Parenthood of Central and Western New York. So I'm going to pass the mic on to Solomé.
Great. All right. Thank you, Debora. Good afternoon, everyone. As Debora mentioned, I'm the Director of Diversity, Equity, and Inclusion at Planned Parenthood of Central Western New York. I wanted to also thank our participants for joining today. I suspect that many of you have probably been receiving countless invitations to webinars, so I thank you for joining us for this really critical conversation today. So before jumping in, I just wanted to frame my piece and around these two really central points. And the first is, like we heard Nayda share, is that disparities in health and life outcomes have always existed along race, right? COVID-19 did not just produce these disparities. It is just really aggravating those disparities that have always existed. And the other point here is that there is absolutely no scientific basis for race. we cannot stress this point enough. It is a social construct that was created by Europeans to justify the oppression of people of color, right? To justify colonialism, to justify imperialism, and to justify slavery. But even though that it is a social construct, there are still very real economic and material consequences to that system. And what you'll hear from me today is actually looking at those consequences, particularly health disparities. So some of this information may not be new to folks. There have been countless news articles that have been sharing these alarming figures, but I'd like to highlight a few for our conversation today. So according to the Washington Post, majority Black counties have 3 times the rate of infections, 6 times the rate of deaths as majority white counties. In Michigan, 40% of those who have died have been African American, while they only make up 14% of the state population. In terms of cases, African Americans account for 33% of cases, which is 10% higher than whites. In New Mexico, Native Americans account for almost 37% of positive COVID-19 cases, even though they represent just 11% of the state's population. In New York City, Latinos and Blacks are dying at higher rates than non-Latino whites and Asian Americans. Latinos account for 34% of all fatalities, and African Americans account for 28%, whereas Latinos and Blacks are 29% and 22% of the city's residents, respectively. Even looking at local data from Monroe County, we see a difference in death rates, hospitalization rates, and ventilators across race, especially for African Americans. The impact of the virus on African Americans has been severe in other ways as well. So according to a report produced by the consulting firm McKinsey & Company, Black Americans will experience a disproportionate share of the disruption from morbidity and mortality, but also to unemployment and bankruptcy. Black Americans are overrepresented in essential jobs and work in the 10 lowest paid jobs that are both high contact and considered essential services. About 40% of revenues from Black-owned businesses are in the top 5 most vulnerable sectors, including leisure, hospitality, and retail, compared to 25% of revenues from all US firms. And about 7 million jobs, which represent 39% of jobs held by Black workers, are now vulnerable to temporary or permanent disruption. And so I'm going to dive a little deeper into these kind of social determinants of health that you heard my fellow panelists discuss. So experts suggest that medical care contributes to about 10 to 20% of a population's health outcomes. The remaining 80 to 90% is shaped by these social determinants. According to the World Health Organization, they are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of power, money, resources at a global, national, and local level. They are also shaped by structural racism, which is the macro level systems, institutions, policies, ideologies, and processes that interact with one another to produce inequities among racial and ethnic groups. There is growing evidence that points to the devastating effects that structural racism has on the health outcomes of people of color, shaping every social determinant and leaving Black and Brown communities even more vulnerable during a global pandemic. On this slide, you'll see examples of the ways in which racism has interacted with each of these social determinants, producing poorer outcomes for people of color and ultimately fueling health disparities. So let's explore a couple of these with a little bit more depth. So when we look at healthcare in particular, Our history in the United States is filled with unconscionable acts of violence perpetuated against Black and brown bodies. Our history includes medical experimentation on slaves, studies like the Tuskegee syphilis experiments, where researchers knowingly failed to treat patients appropriately after penicillin was found as an effective cure, and the decades of forced sterilization of Black, Native, and Latino women. These are just a handful of examples that have shaped the relationships between doctors and patients of color. While such blatant acts of racism may no longer exist, there is still persistent levels of racial bias in healthcare, causing Black patients to receive inferior care, and in worse cases, costing them their lives. In addition to the mistreatment of Black and brown patients, we also know that people of color tend to be underinsured or lack access to insurance, limiting their access to healthcare. So let's look at one other social determinant, economic stability. Now, it is not difficult to understand how economic instability can contribute to poor health outcomes, regardless of race. But when we consider the impact of structural racism on economic stability, we see an alarming racial wealth gap between whites and Blacks, most notably, that contributes to poor health outcomes in Black communities. This racial gap is a result of the legacy of slavery and discrimination, and the inability to build wealth through home ownership because of discriminatory lending practices. And so today, that means that the typical white family has 10 times the wealth of the typical Black family and 7 times the wealth of the typical Latinx family. For each of these areas, we see how structural racism, both historically and currently, leave people of color more at risk of hardship and more vulnerable to contracting and dying from COVID-19. It is these social determinants like access to transportation, housing, and income status, for example, that drive the disproportionate impacts that we are seeing on communities of color. Now, while measures have been instituted to keep people safe, like social distancing and stay-at-home orders, we know that these options are not feasible for everyone. Many low-income people of color reside in urban areas, rely on public transportation, are more likely to live in densely populated areas, and in multi-generational housing environments. When we look at employment patterns, we see that those who are deemed essential workers, like truck drivers, postal workers, grocery store clerks, tend to be Black and brown folks on the front lines, which make them more susceptible to this disease. Many have suggested that the severity of COVID-19 in Black communities is due to the high rates of underlying diseases such as diabetes, obesity, and heart disease. But we cannot talk about this disease burden in marginalized communities without considering the social, economic, and political forces that drive that disparity. It is structural racism and its impact on these social determinants that have fueled this health inequity. Now, another theory that was circulating to explain racial disparities within the Black community was that Black folks just weren't taking this disease as seriously. News stories such as those on this screen point to social media posts that suggested that Black people were immune to the disease. And so, fearing that people would believe these claims, many Black leaders began urging communities to take the necessary precautions to prevent the spread. However, recent polling data provides a different narrative. A national survey conducted by the Pew Research Center between March 10th and 16th, long before racial disparities in infection rates were documented, found the Black respondents at 46% were more than twice as likely as white respondents at 21% to view the coronavirus as a major threat to their own health. According to another Pew survey released in mid-March, Black people were more likely than white people to be buying non-perishable foods, hand sanitizer, cleaning products, toilet paper, and bottled water. So the takeaway here is that while some social media posts may have indicated a lack of concern for the virus, these findings from the Pew Research Group reveal that Black people had a heightened awareness of the threats posed by the coronavirus. And I would say because of the experiences that shape their day-to-day realities. So now that we've spent some time understanding how how COVID-19 has been impacting communities of color, let's delve a little bit into maybe some strategies that we may take as individuals, as citizens, and also as organizations. So I think now more than ever, we must center equity in our organizations, especially as we're, move into this phase of reopening. I think it's important to use an equity lens with regards to decision-making, in terms of who we bring back, in terms of program development and the services that we offer, to ensure that there isn't a disproportionate impact that our policies or our programs are having on the employees of color, but also on the people that we are serving. It's also important that we work within coalitions to fight for better living conditions for the most marginalized, whether it's within movements such as environmental justice, or promoting a living wage, or advocating for family leave. I think the ability for us to work within communities and fight for policies that improve the experiences for people of color is extremely critical right now. It's also important that we fight for anti-racist policies and legislation, that we organize, that we vote, that we become civically engaged. It's also important that we discuss the realities of systemic racism in our country, right, in community spaces, but also in our agencies, so that we can deliver better services to our communities and better support the diverse employees that work for us. And also that we believe people of color when we name racism. The first step to change and to healing is acknowledging that a problem truly exists. And then lastly, it is so fundamental that we work with white allies to engender change. Communities of color cannot do this alone. So I wanted to end with this quote I heard in a webinar not too long ago, which reads, "There is nothing wrong with Black people that ending racism cannot solve." So I hope that this pandemic really pushes us all toward a more just and inclusive version of ourselves as citizens and as a nation. Thank you very much.
Thank you very much, Solomé. Now I'll give you a chance to, yep, you've unshared your screen. And we're going to now welcome our next presenter, Rachel DeGuzman. And if you're just joining us, I saw a few people hop on. Rachel is based in Rochester, and she is the founder and executive director of Woke Art Collaborative. So Rachel, welcome.
Okay, I'm spotlighting my video, okay. Good afternoon, and thank you to everybody that's come before me, Solomé and Nadia, and I want to especially thank Debora McDell-Hernandez. We've collaborated on these type of conversations over the past couple years, and I think that they're critical, and I'm glad to be here during COVID, continuing a social justice conversation presented by Planned Parenthood. I'm coming from a little different perspective, coming from the arts sector, but one of the things that struck me when I was listening to Nadia is that this is something that I want to say very at the top of my comments, that the arts, culture, creative sector is a business sector, a social and business sector. And it's certainly a subset of white supremacy. I think sometimes when we think about arts and culture, we're not really thinking about it in those terms, but it's really critical that we do. And structural racism is its framework. And it has been its framework. So, we love entertainment. We think, when we're looking at all the sectors of society, the racism that exists for artists of color, for, intersectional racism that exists is not often a subject of conversation. But when we look at the segregation, we know it exists. So, before I talk directly about the landscape for Black, Indigenous people of color artists, creatives during COVID-19, it's critical to understand that the arts and culture sector in Rochester before COVID was segregated, and creatives of color, regardless of their perceived talents and expertise, experience acute marginalization and discrimination. I want to emphasize that this is true for some of the local Black and brown superstars, people that you never believe are struggling, who are broadly known in the community, as well as the equally significant creatives whose impact is felt in their respective communities and neighborhoods. Just because the mainstream community does not understand that creatives are having impact in their communities does not mean the impact's not there. I say all this because though that has been the paradigm in which creatives of color have lived and worked, we have been making a bit of progress raising this as a critical issue and recognizing the disparities as we process the impact of the pandemic now and moving forward. My greatest fear is that with the massiveness of the current crisis for mainstream America, nationally and even globally, the slight movement in fostering more equity in arts and culture will be lost, pushed aside as secondary to the crisis in the sector at large. Not centering intersectional racial and gender and class inequities as we vision and make plans for today and the future would be a mistake. This moment demands more of us. I was asked to speak more specifically to communities of color, artists and creatives who were hit especially hard by COVID-19 crisis due to their reliance on the gig economy, and share the success of a recent fundraiser for the benefit of people of color in that group. At the beginning of my career, and I'm sharing this because I think it's really important for you to understand the shift in how I've started to work and how many people who are trying to address racism in my sector have moved. I started out with Garfagan Dance, the Commission Project, Nazareth College Arts Center, and Rochester City Ballet. And that's a producing model of framework of presenting. When I began working on my own and collaborating in community, that experience and expertise has been informative, but really insufficient. It was when I was doing a fellowship focused on equity in the arts with a field in New York City that I was advised by the fellowship program manager to study social justice movements and organizing to seek new models that radically have shifted the way that I have collaborated in the community. And I found that certainly my producing background matters, but if I'm really trying to disrupt racism in the field, it's critical that I adopt an organizing model and approach. And that's what we did, I think, with Live Rock, the Rochester COVID-19 Live Rock Emergency Grant fundraiser, where we raised more than $31,000 in 24 hours with more than 45 acts, including Debora. And as a result, we are awarding 49 grants to Black, Indigenous, and POC community Rochester creatives who have experienced significant losses to the coronavirus. It was built on a hybrid model, but mostly on organizing. Necessity is the mother of invention. That was true here too, as all of us gig workers were starting to get emails, text, and phone calls canceling upcoming events and contract work, and most of the world was starting to close for business. I was talking to one of my fellow Woke Art Collaborative members as she was notified that all of her income was gone. Poof. She has a family to support. I could not get that out of my mind and woke up and thought about the Live Aid concerts of the past. What would it entail? I sketched out the basics. It would have to involve entertainment. It would have to be online in individual homes because Woke Art HQ was closed and we just started social distancing. It would have to be bold to be able to break through the noise. I think someone earlier, either before we got on the call or after, talked about how many invitations we're getting to different live events. So it would have to be something that stood out. So we did 24 hours with more than 45 acts. And as I said, we're a awarding 49 grants to Black, Indigenous, and POC Rochester creatives. And we would need a trusted mechanism for where the funds would go. And I'm really proud of this because certainly before we partnered on with Rochester Area Community Foundation, they had been shifting towards more equity. But I believe that what we did with them actually pushed them a little further in their equitable practices. So, you know, I think that that's a template for other organizations and, you know, to partner with the mainstream and actually, you know, ask them to step up in ways that they've never done before. And I think that, you know, our original goal was $20,000. I want to mention Annette Jimenez Gleason at Rochester Area Community Foundation, because basically I texted her and I said, I have an idea. And it was a crazy idea, you know, to do something very quickly and shift things and to focus completely on creatives of color, and creatives of color that don't work for institutions. They're in the gig economy. So a lot of the people that we were going to benefit fall below that radar. They're Black and brown people that work in their communities, that are doing their work without a lot of public notice, perhaps. And so we were able to form a partnership, a collaborative partnership, but we had to organize more. We did not, Woke-Our Collaborative does not have a 501c3, and Rochester Area Community Foundation could not partner in this way with an organization that did not have a 501c3. So we actually had to then build more community. But one of the things that was really critical from my perspective is from the outset, we really wanted to partner with other Black and brown organizations. It was really important that we not then fold our work into other major organizations' work and have that be a part of, you know, oh yeah, isn't that wonderful that Woke-Our Collaborative partnered with those organizations. So we partnered with Aquaba, the Heritage Associates, and they came on board, more organizing. Acoma Choir came on board to help us in the panel review. We reached out to the community, and the Woke-Our Collaborative stepped up in the programming committee. And so they were reaching out to their networks of Black and brown creatives and really thinking out of the box. I know that Debora did a cooking show. What is a creative within the framework of arts and culture? You know, and who can benefit, you know, from participating in something. And it was so heartwarming how everybody that we reached out to, for the most part, wanted to come on board, even though they weren't being paid. And all the people that participated, most of them were not going to get grants at the end of the process. And so then they spread the word. I think one of the hallmarks of our success was trusting our Black and brown and Indigenous communities to actually come together and do something very positive for their own. And they stepped up, they watched, they donated. We had almost 200 donors. We raised $31,388, and I think 24 cents, and that matters. We raised that much in 24 hours, but what we did also, I think, has disrupted people's notions of what we can do. How our communities can be innovating and leading. And so there's no reason not to have us at tables when you're visioning what the society looks like. I think we've shifted the narrative to a certain degree. And that was one of the objectives, aside from providing emergency grants to people of color, that was critical from the beginning. You know, we wanted to do that. We wanted to we wanted to create community also during this crisis. You know, I think it made people feel a lot better, like they were actually able to control something and be a part of something that was having impact very soon. And, you know, they didn't feel as hopeless. The other thing was that post the event, we had 46, 47 people, work groups, acts. I did a series of post who's who email blast. And I did that intentionally because often the artists of color who are doing work in communities, they're anonymous. They're teaching artists in schools. They're working in rec centers. They work at small clubs. And so it was really critical that they also get some equity and have their visibility raised through the process, and that they didn't just become an anonymous group of Black and brown people who had participated in the event. And also there was an opportunity to share information about all of the people who had participated. So if people had seen them, they know how to contact them. Because even though some of these people were not the ones who are the most at risk and vulnerable during this process, there's general vulnerability in the arts community, which is exacerbated with intersectional racism in Black and brown and indigenous communities. So how could we also, for the people that enjoyed this process, how can they get in contact with these people and perhaps support their individual work? We had a lot of challenges, and I think that I wouldn't suggest that anybody tries to raise $31,000 with spending less than $500, which is what we did. It's a lot of hard work. I think I was working from 8 a.m. to 4 a.m. for many, many weeks. But it's so beneficial to be able to see what you're capable of. Rena Golden provided Zoom training. I had no idea that she had been a corporate trainer before. You find out about people. We reached out to Caris Barilla, who was doing things for Robin Wilt, and he had done these, and he taught me how to use Zoom and actually launch on Facebook Live. For anyone who wants to do something over 8 hours on Facebook Live, you know, from a grassroots community perspective, because that's what we're talking about here, you can do 24 hours, but you have to find out that we had to segment into 6 sections because Facebook Live will kick you off after 8 hours. So it's that organizing, learning, coming together as people of color creatives, which really was how we were able to achieve what we achieved. But I also think that what it has done is disrupted the notion of this whole patronizing attitude about other people having to do for us. You know, and I'm not suggesting that people should raise money without paying artists. They should be paid. But I also think that I would challenge people who experienced it and who are listening now to use their imaginations with resources, with more resources than $500. What could our community coming together achieve? And I have to say that it's because of structural racism and segregation and marginalization that many of the people in the community have not had the chance to actually demonstrate what they're capable of achieving and the contributions that they're capable of making to our community. And the arts and cultural sector in Rochester is probably one of the most segregated and racist that we have. And I don't know that everybody knows that. And that was one of the objectives of this, of the COVID Live-19 Rock, was also to raise the visibility of the paradigm in which Black, brown, and indigenous artists are working on in this community. And mine was storytelling, so that's a story of, a truncated story of COVID Live-19 Live Rock. Thank you.
Thank you, Rachel. Thank you for sharing your experience. I wanted to end our panel discussion on a positive note, and I think your experience in raising awareness to an issue, raising money, and doing all this tireless labor and having success in 24 hours is a nice way to inspire, because we're by no means done with this. There's still a lot more work to be done, even though we're starting to reopen New York State and many other states across the country, but there will be a lot more work to be done. And just your story about organizing shows how much individuals and groups are capable of doing. We're looking for the government for support and assistance, but I think there have been some really remarkable stories out there of thoughtfulness and generosity by many individuals and groups and communities across the country doing what they can do when so many people are in need and they're in a position to offer a hand. So thank you for sharing that. And I'd like to thank all of our panelists again. Again, Rachel DeGuzman, who just spoke on behalf of Woke Art Collaborative, Solomé Rose from Planned Parenthood of Central and Western New York, and Dr. Nayda Pares-Kane from Monroe Community College. And I'd like to end with a quote from a guest speaker who is a professor at University at Buffalo. She spoke at one of our donor events in Buffalo last year. Her name is Professor Noelle St. Ville. And she said, the assumption that access to healthcare is all one needs to decrease these disparities ignores a pervasive problem in our society, the problem of implicit bias. So if I take into account all of the stories that the three of you shared.
At the end of the road, turn right onto Mount Hope Avenue and then use the left lane and turn
Someone's
left.
GPS is on. But anyway, I think that quote really
Now turn right and then
sort of
turn left at the
uplifts
next
what you
track.
all were speaking about in summary. And you know, we all need healthcare systems that work for everyone, but it goes beyond healthcare because there are so many other aspects to the story that require attention, change, and support. So I am going to look in the chat section because I want to give our viewers who've joined us today an opportunity to ask you all questions. And thank you again to the viewers who joined us on this virtual platform. I appreciate your willingness to come out with us now. I'm just scrolling down the chat list to see if anyone has a question that they would like to direct to either of our panelists. I see a lot of thank yous going out to the panelists. Thank you all. Does anyone have a question that they would like to ask of the panelists? And if you do, don't be shy. Please feel free to type it in. Again, I'm just scrolling to make sure. Thank you so much, Nayda, Solomé, and Rachel for sharing your expertise, experience, and passion. That's from Greta. Let's see. All right, I guess we have a quieter group. Oh wait, okay, I do see a question from Robert Hoggard. Can the panelists share more about COVID-19 disparities? Would anyone like to jump in on that?
I can just share a couple of observations that I've made. I think living in New York, we've had a better experience, I would say, with leadership in terms of sharing some accurate information. So the governor has his press briefings, and a few weeks ago when I was watching one of them, he had alluded to a press briefing by the mayor of New York City, de Blasio, and they had put up on the screen what they had found out recently about racial disparities. And again, it mirrors what was happening before, but I was pretty surprised to see just the high level of Latinos in that category. Altogether, we know that those groups experience much more disparity compared to whites, but I really was shocked to see that it had gone up to close to 25% of all cases, and this was weeks ago, we know that that's gone up, was in the Latino community. And, I grew up in Brooklyn, and we know that just because New York City is the biggest city in the country doesn't mean that it is by any means immune to all of these social issues we're talking about, in particular residential segregation and lack of access. So it didn't surprise me in general, but I was shocked to see that that number had been so high so fast. And I think that's what speaks to a crisis like this, is that everything just gets, there's a magnifying glass, and everything is exacerbated. But I still go back to pandemics also exacerbate kind of these racist tropes and stereotypes that exist in society in general, right? And so if we don't acknowledge that and say, and really talk about the fact that these disparities aren't biological in terms of race, they affect the body. They don't affect the body differently because you are of a particular racial group. So I think we just see what we already knew. The problem is that most of us weren't attuned to what was happening before the pandemic. And so we try to find reasons for why those disparities exist. And we don't necessarily look at the systems in which we're functioning on a daily basis as the cause for those disparities.
Thank you.
I'd like to share a couple of things in answer to that. I talked about the grant process, and we are in the process of getting the checks out to the 49 people who received grants. But one of them said, "I have no income, I have no food," as to how it's impacted him. And other people wrote longer responses and more detailed about the gigs that they had lost and shared, text and emails where their world was canceled. But I want to put it in the context of why the Black, Brown, and Indigenous community is more vulnerable. And, I knew it before, but most of the institutions, the arts institutions, the cultural institutions, the school districts where they employ artists, they're not, Black and Brown and Indigenous artists are not employed. The creatives in those places, they start their own thing. They're not going to stop being artists, but so they don't have any safety net. They're contract workers. They may be teaching artists in schools, but if the schools are closed, the work's gone, and you get paid after you actually do the work in the schools. So I think that it's really important to look at the total landscape and see just how marginalized Black and Brown artists. It's not a matter of getting furloughed and getting unemployment from a job where you have a regular paycheck and you're on payroll. Most of the landscape, most of the Black and Brown artists here are not on anybody's payroll.
Thank you for that, Rachel. I have a couple more questions that have popped up. This comes from Karen. What message would you want to share with city and county officials going forward? I don't know if any of you want to take that on. And then I have another question as well. I'm really worried about southern states and the potential deaths for people of color. How worried should I be? What can we do? Any takers?
I can speak to kind of the local politics. One of the issues I think that it has been brought to light is just how decentralized the response is to COVID-19. And so, we know that we live in the United States and our political structure is one that gives the states quite a bit of power. But I think the reason why I say that, the pandemic is a snapshot of who we are and what we believe is that we tend to read politics a certain way based on our social location. And so obviously as a sociologist, I'm focused on public policy and how that affects individual behavior, right, and choices. And so we could ask our local politicians, whether it's county politicians or city politicians, to react, but it's difficult to do that when you have such a fractured political system where you have completely different set of facts being thrown out there. You have ideologies that tend to divide people in crisis, not necessarily unite them for some kind of, movement forward. And so I say we, just like I said in my last slide, we don't like to politicize a crisis, but at the same time, that's exactly when we should be politicizing one, because that is the mechanism in which we can at least begin to address public policy, right? It's people we vote in. It's people that are going to be making decisions, not just economic ones, but how we message things out. And so I think we do need to get involved. I'm going to be attending a meet and greet at 5:30 today for Sarah Clark, who is going to be running for the 136th, seat in the Assembly in New York State. I want to know more about her because I want to get more politically involved in terms of making the right choices. So I think the message is to continue to work with the state and to continue to work with the federal government, but we need to start voting people in who at least acknowledge that the system is fractured, and that is across party lines. We had some Democratic presidential candidates who were really trying to upend the system, right? And they ended up themselves being marginalized, right? And so I don't know that we're necessarily going to move in a direction that is going to take care of the system itself, particularly the healthcare system. But people have to start being bold. They have to boldly state things like capitalism as a structure right now is a racist structure. If we don't acknowledge that, we're just going to continue to see its effect.
Just wanted to jump in here as well. Completely agree with what my fellow colleague just mentioned. I think part of it too is encouraging local officials to reach out to various community-based organizations and leaders of color as they build coalitions and task forces to consider how best to reopen and to consider strategies for supporting groups. There has to be diverse representation around those tables to ensure that communities that are being disproportionately affected have a seat at the table, that their concerns are being elevated to the decision makers and where those decisions are being met, or where those decisions are being held, rather. So again, just ensuring that there's representation around those key decision-making tables.
I co-sign everything everybody said before me on this subject, and I'd like to add that I was part of a conversation that was spearheaded by Rochester Contemporary Art Center, ROCO, and about visioning a WPA, a reinvigorated WPA for artists. And my main point was that it would have to be decentralized and have really be hyper localized neighborhoods and artists in neighborhoods for it to really be something that is that will have long-term impact, because you can't have this whole centralized producing model of something and think of what a WPA would mean to this moment, dismantling capitalism in the arts, And that whole idea of a couple of people deciding, making decisions about how everybody else can contribute to a program like that and what it would look like around the city. So as COVID has forced us to reimagine what the future looks like moving forward, we really have to make sure that we're bringing a lot more people to the table and pushing, because if they're trying to get resources, we cannot let people try to garner massive amounts of resources on inequitable processes and practices. We can't. I mean, I think that it's going to be hard to fight that, but we have to all fight it.
Thank you, Rachel. I'm going to try to get a couple more questions in from our viewers. Solomé, this one, it looks like it's directed to you. Loie says, it really struck me that media had pushed a narrative that Black community was not prepared. That alarmed me as potential for media to victim blame the Black community for their COVID cases. How do we best fight or counter this horrid disinformation? How can we also ensure the most vulnerable people stay safe?
Thanks for that question. Yeah, so I think the way to counter that misinformation is one, to educate ourselves on, the actual narratives that took place. I think, yes, there were some social media activity that indicated that perhaps Black folks weren't taking this as seriously. But I think, when we look at our sources, we need to validate that what we are reading is accurate, and in fact, an accurate depiction of what people are experiencing, what people are feeling. And so I think the ways that we do that is ensuring that we have exposure to a diversity of news outlets and academic journals, et cetera, so that we are getting a more holistic view of experiences that people of color are having as it relates to COVID-19. There have been a lot of very targeted and culturally responsive strategies on the ground. The mayor of Chicago, when she realized that the death rates and hospitalization rates of African Americans were astronomical, created a task force and began to, work in communities to ensure that African Americans and people of color were being supported, had access to accurate information, and really, taking on a culturally responsive approach to supporting the most vulnerable people in her city. So I think those kinds of approaches and tactics where we are thinking about who is most in need and then tailoring our responses to meet the needs of particular groups is vital to flattening the curve and eventually moving out of this phase.
Thank you. I do have a question from Melissa. In light of the phased reopening, are there any words of caution or encouragement to our communities comprised of people of color? I think in some ways you've all addressed this, maybe in some of the other questions, changing the narrative, having the facts, the science, being at the table, being represented in the coalitions that are in charge of making policy. I don't know if you'd want to add anything else to that, but I think this may have been addressed.
I do want to say something on that. I wish there was more centralized information, especially for small organizations, on what that looks like. It's really hard. I mean, I have a space of 4,100 square feet, and we're not going to be in this next phase, starting I guess the 15th. But just trying to figure this out for community-based organizations. How do you open? I understand some of the basics, but there's so much information coming from so many places that apply to places where you can have screening for people to go through temperature, monitors and everything like that. But for a community-based organization with maybe some of the most vulnerable people, there's not a lot of good information out there. So I just want to put that out in the universe and say that if anybody does, maybe that's something they should share broadly, because the bigger organizations will have teams of people figuring it out. But it's harder to interpret all this disparate information that's coming from many places in order to keep people in the community safe.
Actually, I just wanted to just piggyback on what you said too. I mean, this is not the time to hoard resources, right? I think this is the moment where we really should be working with community-based organizations to share strategies, approaches. If we're creating preparedness plans, like we really need to be supporting communities that don't, community-based organizations that don't have the resources and the human power to be producing at that level. And so this is the time to collaborate, to share resources, to ensure that we can all collectively succeed.
Agree completely. Thank you. Thank you both for addressing that. Let's see. I just want to make sure I'm not leaving out questions here. I want to thank Dr. Nayda in particular for pointing out that politics and policy are key to changing systemic problems, and that health inequities are already inherently political, and that we should be politicizing these issues by pointing out that policy impacts the availability and quality of healthcare, social welfare nets, et cetera, and that different parties and different candidates within the parties have markedly different policy ideas. So clearly being politically active is key. Does anyone have any recommendations of organizations which are actively pushing policy ideas? Also, what can be done to pressure the major political parties to shift leftward on policy? Well, I will say Planned Parenthood is a major organization that is actively involved in policy, advocating, lobbying for different legislative issues. So we're one, but there are several others out there. We've partnered with many people like Now Rochester, Indivisible Rochester. There are countless groups out there that are advocating for equality. So it's probably a matter of finding the thing you're most passionate about, or an initiative that resonates with you, and picking up and volunteering, writing a letter to a legislator, making phone calls, showing up at rallies when we're allowed to be in large public gatherings again. I don't know if anyone else wants to add anything to that. I do have another, let's see, is this a question or a comment? The Children's Agenda is pushing policies that support children and families. It's a local organization working at the city, county, and state level. Okay, and I have several thank yous. Thank you to the panelists. Thank you to Planned Parenthood. Thank you, presenters. Looking forward to getting the recording. The recording will most likely preside on social media, so our Facebook page as well as our YouTube channel. So if people are looking for that after this, that's where you should be looking. All right, oops, lost my spot, sorry, hold on. Let's see. Okay, thank you, presenters. Could you or Solomé share what advocacy work Planned Parenthood is doing in regard to some of these issues? So this is from Mona. Mona, one of the things that has really rocked our world is the inability to meet with our activists and supporters face to face, and doing a lot of the live interactions that we've done in the past. So we've moved to a virtual platform for a lot of our programming, and we've started some new series. One of them being, it's called Sex, Love, and Healing, and it's a collaboration with our education department. And in response to COVID-19, we've taken on issues that have been impacted by this. We most recently did a talk on sexual assault and domestic violence. And we invited our allies in Syracuse from Vera House to join Restore staff in talking about the impact of COVID-19 on sexual assault and domestic partner abuse. We also have some other programs coming up, but some of the key issues we want to hit are things like that: family planning, access to birth control, unintended pregnancy, healthy relationships. So those are sort of on the education and advocacy end of things. May is Sex Ed for All month, so we also have some programming coming up. The next one is May 28th, Be an Askable Adult, and we will be doing that with some youth in the Syracuse area who are in some of our programs, but that will have the intention of promoting sex ed for all. And one of the recent bills we were working on getting passed was comprehensive sex education bill, because New York State currently does not have a curriculum requirement for sex education. So we're still continuing to lift that up. We're working on several different things, but we also wanted to be cognizant of how the community was really impacted by COVID-19. So we want to keep our message and our cause out there, but we want to make sure that we're also looking at COVID-19 and how it's changed everyone's sort of day-to-day life. So keep following us on social media. And if you're already in the database, you'll receive notifications from us. I don't know if you want to add anything, Solomé. What is this? And again, I commend Rachel on this response. Thank you. Takes money and resources that many of our communities do not have. Sorry, just trying to scroll down to see if I see specific questions. Okay, lots of thank yous. So everybody love this. Who's asking for the bill number? I do not know the bill number by heart. Let me see if I can find it quickly. This will be amazing if I have it handy.
Hi everyone, I just put it in the chat.
Do you have the bill number handy?
I put the link to the bill in the chat, so.
Oh, good, thanks. All right, check out the link. Who had asked me the question? Mickey Belosi. So scroll down and you'll see the link for the bill. Okay, yep, you got it, thanks. Well, does anyone else have anything they'd like to share? Any questions? I really appreciate everyone taking the time out of their afternoon to join us for this important discussion. I'd like to also thank our guest panelists again for their time and expertise. I'm motivated to do some research and learn a little more about some of the topics that were covered. So thank you, Solomé Rose, for your help. Thank you, Rachel DeGuzman, for joining us and doing your storytelling presentation on a success story. And thank you, Dr. Nayda Pares-Kane, for sort of setting the foundation, the framework, and giving us the overview on sociology and all of these factors contributing to this. So
Thank
check
you,
one more
Debora.
time, make sure I didn't miss a question. Nope. So I'd like to thank you all and wish our panelists as well as our viewers safety and good health and happiness. Everyone continue to be mindful of your safety. Wear gloves, wear masks, wash your hands a lot, just be safe and make wise decisions.
Thank you. Thanks for the opportunity. It was great. Thanks.
Thank you. All right. And
Thank you,
again,
Deborah. Yeah.
thank you.
Thank you, Debora. This is great. And, you know, it's a pleasure to be on a panel and have all this context. It was great. Thank you.
Thank you. All right. Well, everyone, have a great afternoon. And again, visit Planned Parenthood's website, follow Planned Parenthood of Central and Western New York on Facebook and Instagram if you want to have a little bit of advance notice on happenings. All right, enjoy the rest of the day. Bye-bye.